You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, welcome to the Dental Zone. I am Dr. Rachel Hall, holistic dentist from Brisbane, Australia, and welcome to the show. This is the place where we discuss all things dental health related, how your mouth health relates to your overall health, and what you can do to improve your smile, the health of your teeth and gums, and prevent yourself having dental issues. In today's episode, we are going to be talking about Bruxism. Well, what the hell is that? Well, Bruxism is the official term for teeth clenching and grinding. So I'm going to be talking about what causes grinding, what the treatments are, what to look out for, and what to be aware of. Now, if you want to know more about holistic dentistry, you can hop on over to holisticdentistry.au or check out the website for my dental practice, evolvedental.com.au. And if you're looking for a great holistic dentist and you can get to the Brisbane area, then our number to book an appointment 0737 201811. So today we're going to be talking about teeth clenching and grinding, so let's get in the zone. What is Bruxism? What is teeth clenching and grinding, and what happens? How can you prevent it? How can you treat it? What are the problems if you don't address it? So Bruxism, known as teeth grinding, is a sleep-related movement disorder that involves clenching jaw muscles together to grind the upper and lower teeth together. This condition causes a lot of symptoms that can be quite uncomfortable, and it can be asymptomatic, but we can see signs of damage and wear and tear to your teeth. So some of the symptoms you can get are your jaw feels sore, your muscles feel tight and tender, you get facial pain, you can get chronic headaches, you feel like you've got pressure behind your eyes, almost like sinusitis but without the infection. You can get neck pain and shoulder pain as well. It can negatively impact your oral health. It can cause damage to your teeth and your dental work. It can cause damage to the bone and accelerate gum problems and gum disease, and it can lead to the need for expensive dental work and repeated expensive dental work, because if you keep clenching and grinding, you're going to keep damaging your teeth. So why do people brux? Why do we grind and clench our teeth? Well, there are two types of bruxism, and both types are caused by a combination of things. Some of the previous assumptions about grinding, that it's caused by stress or it's stress related, have been challenged by science over the last couple of years. So when dentists say to you, oh, it's because you're stressed, or you believe it's because you're stressed, you're not actually on the money here. Actually, really overlooking and overshadowing what the reasons are and what those underlying causes are. So researchers have actually discovered that one of the major factors that plays a part in some cases of bruxism is sleep apnea. Now, sleep apnea is restricted airflow to the point that your airway actually restricts and collapses and you struggle to breathe. You actually stop breathing. And this happens, can be 10, hundreds or even thousands of times a night as your airway collapses and you can't get air in. Your brain signals that you need to grit your teeth together to try and get some air going through. Now, sleep apnea can be very dangerous. It can cause some serious and significant health issues, and I have covered that in other podcasts, and I'll probably touch upon it a little bit more later on in this episode for you today. Now, treatments that have been the first line in the past for bruxism have been replaced with more effective and sometimes less invasive options. So let's look at the types and the causes of bruxism, as well as the treatment options that are available for you, because grinding your teeth doesn't have to be a lifetime sentence. So what happens when you grind or you clench your teeth? Now, your teeth are made of incredibly strong materials, particles and minerals that make up the enamel and your bone structure. And these particles are called hydroxyapatite. Now, your enamel is the strongest thing in your body. Now, when you clench or grind, you're exerting massive forces, massive pressure on your teeth, hundreds of pounds of force on these strong but small tooth structures. Now, if you tried to grit your teeth together really hard while you're awake, there's a protective reflex that tells you you're pushing and creating too much pressure, and your jaw will naturally pop open. It's a bit like if you touch something hot, your hand recoils before you've even realized you've burnt yourself. It's like it moves and then the signal is, ow, I've burnt myself. Well, there's a similar reflex that happens in the jaw because of pressure, particularly on the lower front teeth, that pops the jaw back open. Ever bitten on something hard in your food, like an olive pit or a bit of grain or something in there that isn't cooked, or a little stone, your jaw will fly open. It's not a nice feeling because the muscles go into a bit of spasm, but it's a protective reflex. Now, that protective reflex is almost completely switched off and shut down while you sleep. So the amount of pressure that you can exert far outweighs anything that you can do during your wake hours. So if you clench and grind, if you grind in particular, your teeth will wear. When you clench, you put unusual forces on the teeth because you don't normally clench in your normal bite position. It's normally skewed into a postured position, and then you start to put abnormal forces on the teeth at angles and at loads it was never designed to. So when you grind on them, you will wear them down. When you clench on them, you risk cracking and splitting and breaking your teeth, even your healthy ones that have never had a filling. Now, the consequences of bruxism worsen over time. So the longer you are grinding and clenching your teeth, the more at risk you're going to get issues. So there are some common results of grinding your teeth for a long time without treatment. So the consequences of teeth grinding are you get premature wear and loss of enamel. Now, constant grinding can remove layers of tooth enamel, making them more susceptible to sensitivity, tooth decay, cavities. Fractured teeth. Teeth that have unrelenting pressure from clenching and grinding end up cracked or fractured and can end up requiring a root canal or even extraction. If you do crack a tooth, you often need to have a crown put on that tooth, and that's expensive and invasive dentistry that you probably wouldn't have needed. You can wear your teeth down quite significantly over the years with aggressive clenching and grinding. Your teeth will look more yellowed and they prematurely age because of the clenching and grinding forces. It accelerates their yellowing and makes them look old before their time. You can get gum recession. Grinding can exert, I won't do it in kilograms because it just makes it sound really weird. You can exert like 250 pounds of force per square inch of tooth surface. This is a massive amount of force, and this muscle activity is swinging your tooth around in your jawbone like knocking a fence post from side to side in the ground. If you wriggle something side to side enough, you will, like this fence post, you'll open the soil up around it, the tooth's going to get loose and the soil's going to fall away from around the fence post. The same kind of thing happens with your tooth. That pressure and activity pushes the gums away from the teeth and can cause gum recession that is irreversible. Then receding gums can lead to decay because bacteria can get into the recessed space. The roots of the teeth aren't covered by a protective layer. There's no enamel on them. So you get decay more easily. You get plaque and tartar build up more easily because the root surfaces are more rough and porous. And you can end up with significant tooth sensitivity as well as decay and recession problems. Now, the most common thing that goes hand in hand with bruxism, with clenching and grinding, is temporomandibular jaw disorder. So TMJ is the abbreviation for the temporomandibular joint, and we often call it TMJD or TMD, which is temporomandibular joint disorder. Grinding puts a lot of pressure on the joint, the jaw joint, which can lead to the disorder. TMJ, TMD, interchangeable. It's going to cause pain in the jaw joint itself. It can cause inflammation. It can cause long-term inflammatory damage, which can cause arthritis in the joint. You get pain in the joint muscles and ligaments, pain in the chewing and clenching muscles. You can get clicking or popping of the jaw. You can get lockjaw. So when you open, it locks out and doesn't close again. And needs manipulating back into place. You can get difficulty chewing and sometimes difficulty speaking because everything's so sore. You can end up with sore teeth, sensitive teeth as well. You can actually get quite severe pains and it can be debilitating because it's chronic and consistent. Migraine headaches are very common because of the force exerted on your facial muscles. Grinding your teeth can cause tension headaches, migraine, and chronic migraines. You can also wake with morning headaches, and that can be a sign of not only clenching and grinding, but also sleep apnea. So what are some common conditions associated with bruxism? Now, there are a number of conditions and other symptoms that are closely associated with teeth grinding and or sleep apnea. And I'm going to explain that as we go on. It's not clear whether or not all of these conditions are caused by bruxism or obstructive sleep breathing or the other way around. But it's possible that you're at a higher risk for these medical conditions if you grind your teeth. Now, restless leg syndrome, which is where your legs move uncontrollably during your sleep, they say that may be associated with bruxism and sleep apnea. Findings aren't that strong. Chronic kidney disease, depression, sleep disordered breathing, behavioral problems in children, gastroesophageal reflux disease or GERD, and obstructive sleep apnea. Now, there's the types of grinding. In the past, all bruxism was attributed to similar causes, but there's actually two distinct types of grinding. They're not always correlated with the same causes. So again, it's one of these things that isn't that well understood. It's a parafunctional issue. It's something that we shouldn't be doing, and yet our body does. We're asleep. We're unconscious. We don't know it's doing it. The amount of patients that say to you, clench and grind your teeth. No, I don't. I'm like, how do you know you're asleep? How do you know? Unless you've got symptoms that are really obvious for you, as in you get facial pain, you wake up with your jaws gritted together or something, you wake yourself up because you can hear yourself grinding. How do you know? You're asleep. But we see dental signs of the wear and tear, the stress lines through your teeth, wear and tear that does not match your normal bite pattern, but matches a position that we can put you into to go, yep, that's where you hold your jaw when you clench and grind. We can see those signs. We can feel through the muscles. We can feel the tightness. You can exhibit the soreness. We can hear the clicking and the popping. We can see the abnormal movements sometimes your jaw makes when you open and close. So all these things are telltale signs. But just because you don't experience yourself clenching and grinding doesn't mean it's not happening. That's like saying, oh no, I don't snore. Well, if you're asleep and you can't hear yourself, how do you know? So when your dentist says to you, I can see signs of clenching and grinding, don't just push back. Listen, take it on board. Wait for them to explain about it and what the implications are. Gather the information and then, sit with it. Don't just say, oh, no, I don't. Because they're trying to tell you you've got a problem that is going to damage not only your teeth and gums, but your jaw joint, and you can end up what we call a dental cripple because you end up with such severe problems with your jaw joint and your muscles that you are in constant chronic pain. So please take it on board when we're saying to you, hey, this is what I'm seeing. Okay, types of grinding. Awake bruxism. Have you ever noticed you're staring at your computer screen or you're driving along in your car and you suddenly unclench your teeth? That's an experience of tooth grinding or clenching while you're awake. And if this happens often, you might have awake bruxism. It can be due to emotions like anxiety, stress, anger, frustration, or tension. And it can also be a coping strategy or habit that you do while you're in deep concentration and you have no conscious kind of awareness of it until you stop doing it. But I normally sense with my patients, if they're doing awake bruxism, there has to be some nighttime bruxism going on as well. So the sleep bruxism, grinding at night, is actually a different issue for most people than grinding teeth throughout the day. While daytime grinding is often more an emotional or habitual issue, sleep bruxism, nighttime bruxism, is more likely related to your sleep quality. And this sleep-related chewing, clenching, and grinding activity can be happening in relation to being awakened during the night, even if you don't remember waking up. These waking up or arousals during sleep happen in the course of sleep apnea or due to other forms of sleep disordered breathing. So that can be restricted airflow without you actually stopping breathing. Common causes of bruxism. It's a multifactorial health issue, which means it's caused by a combination of factors, and it can be hard to distinguish what actual causes are at play. There isn't a single cause of bruxism in every case. It's a controversial area of research. We still don't know enough about it, but there are 3 general basic parts defined as the causes of the etiological factors of bruxism. And these are what we call peripheral factors, psychosocial factors, and central factors. So peripheral factors, these would be things like a misalignment of your bite that may cause grinding of the teeth. These factors like poor occlusion of the teeth aren't as clear as a cause of bruxism as other factors. That being said, if your teeth aren't lined up correctly, it may cause your jaw to be unstable, especially if you've recently had a tooth extracted or had major dental work done. Then this misalignment can cause you to clench and grind your teeth. Although it might not be a direct cause, it can contribute to the TMJ pain you may be experiencing. So we need to have a look at your bite. We need to have a look at the occlusal forces. We need to make sure those bite forces are balanced and not all just hitting in one or two particular areas and then making the loading on your jaw unevenly distributed. So then you've got your psychosocial factors. It's hard to kind of pinpoint this. There seems to be some relationship. It seems to look through epidemiological studies that these aren't clinical trials, though. They're more kind of maybe a little bit more anecdotal, but teeth grinding does seem to happen more often, or seems to be increased in intensity, shall we say, for people who are dealing with things like depression, high levels in sensitivity to stress, abnormally high levels of hostility towards others. So when people are frustrated, there's resentment, there's anger, there's dislike of people in general. They seem to clench and grind more, and also anxiety indicates that we will clench more than if we're more calm and relaxed. So you might just then piece together from this that your psychosocial factors for teeth grinding are probably more associated with daytime or awake bruxism rather than nighttime. So if you do catch yourself grinding or clenching your teeth during the day, relaxation techniques may help for this type of daytime bruxism, but are not going to be effective for sleep or nighttime. Some cases of anxiety and stress-related bruxism during the day may add to nighttime clenching and grinding, though, particularly, if you're one of those people who your mind whirs even when you're sleeping, you've got a lot of stuff emotionally playing out while you sleep, then you can be clenching and grinding while you're sleeping because of that. Then there are central factors. These are also called pathopsychological factors. And this is the focus of a lot of the current and up-to-date research with sleep bruxism. And these central factors of teeth grinding are about internal systems that are out of balance, that in some way are there in the presence of the bruxism. So there can be some things going on with your central nervous system. Nighttime grinding is closely associated with arousal responses during sleep. And arousal responses, that means moments of sleep that you're awakened or lifted or brought up from a deep sleep state into a lighter sleep, like REM sleep. Often you're not going to remember these nighttime arousals. It's not like you wake up and you go, oh, I've just woken up. But a sleep study can help identify whether you're not sleeping soundly or you're getting these arousals where you're being lifted from a deep sleep state. Now, the sleep study needs to be done where you have little electrodes and monitors popped onto your body, and they measure your breathing rate, your depth of sleep, brain waves, all sorts of heart rate, blood pressure, all sorts of things going on with that, and that can determine whether you're getting these arousals. More and more of us now are beginning to see that sleep bruxism may be one of the signs or first signs of obstructive sleep apnea. There's also a connection with bruxism between some of the neurotransmitters and the act of grinding. Your brain uses systems to communicate movement to the body, and it seems to be disrupted in bruxism. It's the same system that's implicated in the development of Parkinson's disease. Don't worry, just because you're grinding and clenching your teeth doesn't mean you've got Parkinson's doesn't mean you're going to get Parkinson's. It's a disruption of the central parts of the brain that comes out as teeth grinding. It's disrupted in a different way during teeth grinding than it is to Parkinson's. Don't listen to this and go, oh, she said if I grind my teeth, I've got Parkinson's. That is not what I said. It's the same system within the body. And if that central factor for teeth grinding is there, it seems that it could even be inherited, that it seems to run in families. We don't really understand why or what that is, but it just seems to be quite common. It also seems to be that women, I don't know whether women are more affected by TMJ, whether women clench and grind more than men, but they certainly seem to develop more symptoms, although men will tend to wear their teeth down and not get symptoms. It's strange, but they don't get the symptoms of pain and the headaches as much as women do. Maybe there's some hormonal factors going on there. Now, there's a group of bruxism caused by central factors that seems to be worsened or heightened or linked to certain medications, and clenching and grinding is a side effect of these type of drugs. SSRIs, serotonin receptor inhibitors, that's a type of antidepressant. L-Dopa, although this can actually help with grinding when taken in short-term periods. Amphetamines, including drugs for ADHD, nicotine, anti-anxiety medications, and antipsychotics, so things like neuroleptics. These drugs all seem to interfere with the sleep patterns and deep sleep and going into REM, the rapid eye movement sleep. And those things then cause you to clench and grind more because you're not dropping into that deep state. So what are other risk factors for bruxism? Well, alcohol consumption, drinking more than 6 cups of coffee a day. Obviously, there's something there about the caffeine. And if you smoke or chew tobacco, so again, the nicotine, but the smoking, it inflames the oral mucosa, it inflames the nasal passages, and then they become swollen, and that limits your airflow. Things like enlarged tonsils and a narrow airway, which is a physiological thing, will also increase your risk for bruxism because it increases the risk for sleep apnea and obstructive or restrictive airflow or nighttime breathing. So it might be because of the signs that we see in your mouth that your dentist, me, might be one of the first people to warn you that you've got sleep apnea because we see the first signs of it. So sleep disorders like sleep apnea and the less severe upper airway restriction syndrome could be contributing. It could be a factor that makes you clench and grind. Now, sleep apnea, OSA, used to be considered as a disease that was common in obese and older men. But obstructive sleep apnea now seems to be much more common and prevalent than we previously thought. Somewhere between 2 to 5% of people struggle with sleep apnea. And I would say it's probably higher than that because it goes undiagnosed. And then if you add in upper airway restriction, that would go up quite significantly. There was a large study done in the UK, comprising over 13,000 subjects, that found that obstructive sleep apnea was the highest risk factor for nighttime grinding. So if we're seeing, as your dentist, signs of clenching and grinding, and then I have a look in your mouth and you've got a big, large tongue that takes up a lot of room, you've got a long, dangly, soft palate, and if I get you to go, and your tongue won't let me see down the back of your throat, that's a bit of a giveaway of sleep apnea. Or if I look down your throat and you've got bloody big tonsils or you've got a very narrow airway, then I'm going to put that information together and say to you, there's a high chance you've got sleep apnea or restricted airway, and you should get a sleep study done. And we should also engage the support of an ear, nose and throat specialist if we're seeing things like large tonsils. Okay, so sleep apnea and bruxism are connected. It's not a surprise that these two go hand in hand. So during an apneic episode, the airway is closed and the airway pressure drops to zero. In order to alert the body to reopen the airway, the brain initiates an arousal, essentially to draw you out of this deeper sleep. This arousal can be happening by clenching and grinding the teeth together, which will cause some movement and restart breathing. I also suspect that when we clench together, it helps pull and tense the muscles in the throat and neck and face back up and pull the tongue forward, as well as open the airway so that you're getting some more air as well as being stimulated to breathe. I want to point out that some evidence says that bruxism as a result of poor sleep quality in sleep apnea is there, whereas other studies suggest it's a direct response. So it doesn't really matter why it's happening. You know, is it a response or is it this or it's that? It happens. The two go hand in hand. So it needs to be properly diagnosed. It needs to be taken seriously. So this area where you go, oh, it's fat older men that get apnea, it's not true. Because if you look at younger people, they actually grind their teeth more at night than older subjects. Bruxism doesn't discriminate by gender. Women are just as likely to grind their teeth as men. Fortunately, it seems that resolving sleep apnea for some people will correct the issues with grinding the teeth. But one area that most is of, let me just take a breath. Too many thoughts all rushing in at once. I hope you're enjoying this, guys. I hope it's giving you some information and that it's giving you the opportunity to join the dots. But one area that is of utmost importance with bruxism and breathing disorders is the way they impact children. Teeth grinding in kids is a lot more common than you think. About 40% of children grind their teeth at least once a week. And kids who do clench and grind, particularly with more severity, seem to be a little more withdrawn and socially awkward. So bruxism in children is associated with mouth breathing, snoring, restless sleep, drooling, stomach sleeping, and lack of sleep. And it can also be linked to bedwetting. There's a close relationship between childhood sleep apnea and grinding teeth. And this is important to realize because sleep apnea in children, the symptoms are so very similar to ADHD, and it can be difficult to distinguish the two. The studies that have estimated that up to half the children with ADHD may actually be misdiagnosed and be suffering from sleep apnea. So I've said to parents with children who've got signs of bruxism, especially if they've also got behavioural issues, to have sleep studies done to help determine if the symptoms are related to the same root cause as the grinding. If you can't afford a sleep study, then for your child, then I recommend you sit and you observe them at night. Do they breathe through their mouth? Do they sleep on their stomach? Do they drool frequently? Do they wet the bed more than would be typical for his or her age? Are you having difficulty getting your child dry at night? Now, my son's going to hate me for saying this, but we experienced that with him. And once we supported him he had a very narrow upper arch. He had been a thumbsucker as a younger child. And because of that narrow archway, he had a restricted airway. He didn't necessarily have apnea where you'd see him stop breathing, but he would mouth breathe at night and he would be a bedwetter for longer than he should have been. And once we started to, you can expand jaws in young children because the two halves of the roof of the mouth aren't fused together yet. Simple little appliance that they wear, and it pushes the jaw sideways to get some growth, and that then allows the lower jaw to grow downwards and forwards properly, and that improves the airway because the jaw's sitting in its advanced position. Once we did that, his bedwetting stopped immediately. Within a few months of having his jaw expansion commenced, his bedwetting stopped. So I can say he didn't have behavioural issues, but he had some signs that he was having difficulty breathing at night. So if you've got these issues with your child, then you need to discuss this with your dentist and a paediatrician to figure out how to proceed with treatment. So for you, how can you find out if you are clenching and grinding your teeth? How can you find out if you've got bruxism? Well, there are some symptoms that are a little bit of an indication. They're indicative or predictive for bruxism. So these are daytime sleepiness, that you're just kind of nodding off, you feel drowsy, you don't feel refreshed when you wake on a morning, you're just a bit sluggish and you can fall asleep quite easily. The need to get up and urinate in the middle of the night, snoring, waking up frequently at night, jaw pain of clicking in the jaw joint when you open your mouth, chronic headaches, tooth sensitivity. You can get a metallic taste in your mouth if you're grinding on your metal fillings, which means you're releasing a lot more mercury from those old amalgams and you're giving yourself some hits of mercury toxicity. Now, the best way to diagnose grinding, whether it's related to sleep or not, will be to see your dentist. At your next 6-month check, ask your dentist if you see any signs of clenching and grinding. I check for this regularly anyway, and all my new patients get a proper screening for TMJ issues. Just excuse me a moment. I have a look at the teeth, I have a look at the bite, I have a look for signs of wear and tear, I look for abnormal bite, uneven bites, irregular bites. I feel the jaw joints with the teeth closed together, with your mouth open. We check for any pain, we check for any clicks, pops, grating, crunching noises. I then have a feel along all the chewing muscles to check for any tightness, soreness. I will feel around the muscles in the head and neck also, because these give me indications of whether these muscles are overworked and tight. I will look at the size and shape of your tongue, and I will have a look down the back of your airway. There's also another test we do where we get you just to open wide and we see how much of the back of the throat and your airway we can see, or whether your tongue blocks us from getting a visual on that. All these things are indicators. So we look for, we look for abnormal tooth wear, we look for flattened teeth worn down by excessive pressure, we look for chipping, cracking, breaking, and there are stress lines called striations that we can see through the teeth. We look for abfractions, and this is where we see the loss of tooth tissue along the gum line. These can be all signs of clenching and grinding, as is gum recession and that sort of thing. Now, I will touch upon this. If you've got inflammation in your gums, which means you've got bleeding gums, red gums, swollen gums, you've got active gum disease. If you clench and grind, clenching and grinding will accelerate gum disease and the damage caused by it very quickly, and you will end up losing significant amounts of bone from around, particularly your chewing molars in the back. And you can end up losing teeth from what your dentist will say is gum disease, but it's actually gum disease being worsened by clenching and grinding. So there's a lot of reasons to get this addressed and get it diagnosed properly. Now, the treatment options for bruxism. Now, sadly, guys, there is no known cure for it. We don't know how to stop it. There's no known cure. Because of the complicated nature of this condition, it's hard to offer something that's going to fix everything for everybody. Because there's so many factors, but there are some common ways of treating it that are effective, depending on the reason that you're getting symptoms. Now, we want to do something that's cost effective, that's not invasive, that is reversible, so it doesn't cause any irreversible damage, and it's going to save you from some significant problems and significant expense going forward. So number one is a night guard or an occlusal splint or a night splint. So I'm a sleep medicine trained dentist. So I'm trained in using oral appliance therapy to help resolve sleep disordered breathing, and that includes the prescription of night guards and occlusal splints. It's often the first tool in our arsenal for treating bruxism. It is also still the first recommendation of the dental associations for nighttime grinding, accompanied by stress relief technique. These devices are actually called occlusal splints because they are a specific type of night guard used to prevent damage from grinding. However, there's a caveat on this. There's a major problem with providing a night guard because if you have mouth breathing or sleep apnea, it can potentially worse than that, particularly if the night guard is made too bulky, because that then limits the space for your tongue, and it means that your teeth can also be too far apart and you can't get your lips together. So if we limit the space for the tongue, we're actually restricting your airway more, and if you can't get your lips together, you're going to mouth breathe more prominently, and this is where we encourage mouth taping. Lip taping, mouth taping, yes. So your teeth may be protected from some sort of breakage and wear and tear, but if your disordered sleep breathing is the cause of the symptoms, we've got to deal with the sleep apnea, the sleep disordered breathing, as well as the grinding. And a night guard should only actually be a temporary solution in many cases. So the night guard, as I said, can worsen sleep apnea because your airway gets closed during what's called an apneic episode and you stop breathing temporarily. Grinding and other sleep movements are triggered by your brain's attempt to push your jaw forward to reopen the airway, and a night guard can actually push your jaw back further or interfere with the thrusting or grinding your body is trying to use to reopen your airway. Now, a well-trained sleep medicine dentist understands that they've got to use certain shapes and designs of oral splints, of nighttime occlusal splints, to help with bruxism and support you if they suspect airway issues. So there are different shapes, different sizes, different functionalities, and different ways to help position the lower jaw so it doesn't sit further back, and that you can still use that thrusting or grinding to help open the airway. So should you use a night guard for bruxism? Well, the debate here is, okay, on one hand, the night guard's going to protect your teeth from some of the wear and tear caused by grinding. It's also going to stop you ramming your jaw joint up against your skull and crushing the living daylights out of your teeth and straining the muscles and creating inflammatory damage in your TMJ. So that can support that way, but it could worsen sleep apnea if that's truly the cause of your bruxism. So if I'm uncertain and there's too many signs of potential sleep apnea, I'm always going to get you to get a sleep study before we make a night guard to protect your teeth. So as a dentist, I can help scan your teeth and fit a night guard that's custom made specifically for you, that it's going to fit well. And this should be the first step, is to see your general dentist. Get one who's got an interest in sleep apnea, and that's going to be a much more beneficial way of going forward. Now, if you have got sleep apnea, you need to get some sleep apnea treatment. If sleep apnea is the cause of your bruxism, you need to get sleep apnea treatment in order to stop or reduce your grinding. Now, the first line is a positive airway pressure machine known as a CPAP, which is constant pressure going through, or, these are typically used for cases of moderate to severe sleep apnea, and they are very effective in reducing nighttime arousals due to got so much to say. It's effective in reducing the nighttime arousals due to interrupted sleep breathing. Now, sadly, these things can be a bit cumbersome. They can be hard for people to get used to. They can be difficult to sleep with, but they have improved over the years. It's really important that you have the CPAP mask fitted properly for you. The machines are much smaller and quieter, and now some of the machines, they only send air through when they sense a drop in pressure, so it's not a constant blow and stream of air coming through. But the old school thinking will overlook a lot of cases of mild sleep apnea, and also the less severe UARS, upper airway resistance syndrome. And I think this is a mistake, because just a few nights of poor sleep and mouth breathing can have really negative impacts on your dental and your overall health. Some of the most common sleep apnea treatments include an oral appliance called an MAS, a mandibular advancement splint. Now, there's controversy around that. I think a lot of them are not poorly designed, but you're taught as the dentist, you've got to get that lower jaw as far forward as possible to improve the airway, and that can put a lot of strain on the jaw joint and make TMJ issues worse. There are different ways of getting these appliances in that will give a better result without straining the jaw joint. Now, if you've been diagnosed with mild sleep apnea or upper airway restriction syndrome, then there's some treatment options. Now, the first two on this list that I'm going to go through now are going to give you some release. So positional therapy. This means you've got to learn to sleep in a way that is going to help correct mild obstructive sleep breathing. Now, sleeping on our backs may be one reason sleep breathing is problematic in our modern society. And positional therapy is one way to get over that. Gravity dictates that when you sleep on your back, your jaw and your tongue are going to fall back on your throat. And this position means you are more likely to have airway collapse. So switching to a side sleeping position uses gravity to free the airway. If your sleep breathing is interrupted because you're a back sleeper, changing positions can significantly improve the position of your airway. Now, there are devices that can help out with sleeping in new positions. I've seen people put a tennis ball sewn to the back of their pajamas, or you put a backpack with the tennis ball in. Essentially, you want to be able to do what you can to sleep on your side during the entire night. And that may mean using like a bolster pillow or something like that helps you to sleep on your side. The other thing that I find works really well, and I do this myself, is mouth taping. Now, I do have a tendency, I've got a small airway, and I do have a tendency to mouth breathe. I know I like to stomach sleep. I know I drool. I've had issues with clenching and grinding. I wear a night guard. So I'm very aware of this. I'm not a good sleep breather. And even if you are a good sleep breather, I still recommend this. I do mouth taping when I go to sleep at night. I know it seems really bizarre. I've got videos on YouTube about mouth taping. I should do some more. I think there's some blogs that I've done that cover that as well. I may have done a podcast on it, or I may be thinking about one, which makes me think I've done it. And if not, I will do one, and then you can refer to that. So it's a seemingly bizarre thing to do, but it is a great way to retrain yourself to breathe through your nose. And in some patients, and I've seen this in myself and with members of my family, mouth tape can reverse mild cases of interrupted sleep breathing. Now, you can buy specific mouth tape. There's sleep strips. You can just use micropore tape, surgical tape if you're not allergic to it. They're comfortable, it's gentle, and it's good for even sensitive skin. I think one of the brands is called Somnifix. So you can look that up. And if your skin doesn't normally react badly to adhesives, you can try the micropore tape, which is a cost-effective way of doing things. And then basically you just put that strip of tape over your lips to help hold them together while you sleep, and it teaches you to nose breathe. Now, don't freak out, don't panic, don't think you're going to suffocate. And if you do feel a bit stressed with it, then what I suggest doing is that on an evening, after you've had dinner and you're relaxing, maybe watching a bit of TV or something like that, or reading a book, just mouth tape. And just train yourself for maybe 5, 10, 15, 20 minutes and increase that time. I know your family are going to think you've gone completely mad. Just train yourself with that to breathe through your nose, or put it on as you go to bed and just lie there for 10 or 15 minutes with the mouth tape on, focusing on breathing through your nose, staying as relaxed as you can, and then you can take it off, go to sleep, or you may find you actually go to sleep with it on. And as you train yourself, just have a go. You can get nasal strips to help open your nostrils as well if you do find that you have problems with sleep breathing. Improving airway pressure with a CPAP machine may be able to resolve bruxism that happens as a result of sleep apnea. Two major drawbacks of these machines is they can be intrusive, they're awkward, and they can be rendered completely useless if you sleep with your mouth open. So again, you should be mouth taping while you're using your machine. Now, you'll have a sleep physician or sleep specialist who will work with you to find the best machine for your lifestyle and your budget. I touched on this earlier. There's oral appliance therapy. Even if you don't have sleep apnea, but you do grind your teeth, the two oral appliances for sleep apnea can reduce bruxism, cut down on related symptoms like snoring and daytime sleepiness. And these devices show similar improvements in treating obstructed sleep apnea. So you've got your mandibular advancement device or mandibular advancement splint, same thing, MAD or MAS. This is the standard go-to device for mild to moderate sleep apnea, and MAD can help position your jaw forward and a little bit more open to improve your sleep breathing. You need to see a dentist who is trained in this for a custom-made MAD, and you may want to consult with your health insurance before requesting, because not all health companies will cover them, and you may want to do a different treatment first. Some insurances insist you try that you start with a CPAP machine before they'll pay for you to have a oral appliance. You can do a combination of therapies. You can use an MAD with a CPAP machine and put some positional therapy into place as well. The appliances, the MASs, are a great solution for poor airway, but it can take you a bit of time to get used to. It's uncomfortable at first, but it is well worth the effort when it's needed. If you don't have a diagnosis for sleep apnea, but you struggle with bruxism, you can still get one of these appliances from your dentist, but just be aware that it might not be covered by your healthcare funds or your dental insurance in this place. Now, there's another device, a little bit controversial and not something I've ever prescribed. This is called a tongue retention device, a TRD. So rather than pulling your jaw forward, this device works by pulling your tongue forward or helping you to position your tongue properly, because your airway can be limited when your tongue isn't in the right place. Now, they're cheaper, they're lower cost than an MAD. I mean, an MAD MAS is a custom-made device that you get through your dentist, whereas you can get a universal TRD online for a small fraction of the cost. There's one called, Good Morning Snore, and it's found to be very comfortable and easy to use, and can be about a fifth to a third of the cost of an appliance that gets made in your office. You can use, for bruxism, you can use muscle relaxant medications, inconsistent. Some patients have Botox injections. It paralyzes the muscles. It's injected actually into the big clenching muscles on either side of your cheek. It's indicated in extreme patients. For people who have amphetamine abuse and things like autism, it seems to work pretty well. Because daytime grinding is associated with the psychological issues like anxiety or depression and stress. Some medications can reduce the symptoms of bruxism. But long-term use of antidepressants, as I've talked about, can actually result in more bruxism. Unfortunately, there isn't really a medication that really helps with this. So I'm not going to recommend anything here. It's something you might want to talk about with your GP. There's biofeedback and psychotherapy techniques that have been used with moderate success. I don't really know a lot about it. I haven't done that much looking into it. It's still kind of like early on, not really effective from what I understand, so they're not suggesting this treatment. Relaxation techniques, they've shown to do very little to resolve sleep bruxism. It might help with your daytime stuff, but definitely not your sleep stuff. But if you don't sleep well and you do have high stress, then there's nothing wrong with doing things to reduce that. One of the things I've had great success with my patients is head and neck physiotherapy to help train patients to position their tongue and jaws in a more favourable position during the day. And that seems to help alleviate some of the symptoms of TMJ, but it's not going to cure it. Then we may have to rehabilitate your bite and build up your teeth again, or balance your bite. Sometimes we need to change fillings over. Sometimes we need to make dental crowns, and we need to use really strong crowns in this situation called Bruxism crowns. They're all porcelain, but they're made of cubic zirconia, and they help to, they're much more resistant to wear and tear from grinding. They can take larger amounts of pressure, but there's some indications that you might be actually breaking off microscopic particles ending up with zirconia in your airway, and that may cause respiratory issues. But sometimes you've got to have a trade-off where if you're just destroying your teeth, that we've got to do a Bruxism crown to make sure that things don't deteriorate. Anyway, I'm rambling a little bit there. Sorry if that didn't come across very well. The other thing that we can look at is orthodontic treatment. Many cases of bruxism aren't actually caused by poor bite, but having said that, I've found that for some patients, and myself included, getting my bite corrected helps to reduce my TMJ issues and symptoms. I don't seem to clench and grind as much, but if you do have clenching and grinding and you've got a poor occlusion, then orthodontic treatments like clear braces, Invisalign can help, as well as getting what we do called occlusal equilibration, and that's where we balance your bite to correct your bite to relieve some of that pain. So to summarize, teeth grinding, bruxism, clenching, it's a habit of grinding and clenching your teeth, can be day or night time. There's no one size fits all cause, and there's no cure for bruxism. There are things we can do to alleviate it and reduce it. Sleep bruxism, I think, is strongly associated with sleep apnea and upper airway restrictions. I don't recommend continuing for treatment of bruxism with a night guard until you've confirmed whether or not you have sleep apnea. If your child shows signs of bruxism and displays behavioural issues, important to get a sleep study and determine if sleep apnea is the culprit. Then there are treatments available. There are different ones that can suit your budget and your lifestyle. Let's get to the bottom of it and get this treated properly. Now, I will recommend night guards very regularly for my patients. I think it's a great non-invasive preventative treatment. It's going to reduce the risk of cracking and splitting teeth. It's going to reduce the risk of you destroying your dental work very quickly. People who clench and grind their teeth destroy their fillings. They break crowns. And a night guard is a way of protecting your investment as well as your teeth. So if you think you've got clenching and grinding, if you think you're suffering from bruxism, if you do have sore jaws and facial pains, then please go see a dentist, particularly one who's got an interest in sleep apnea or what they call sleep medicine dentistry, so that they can help you get to the bottom of the cause and get it treated so that you can get the best results in relation to your specific issue. Thank you so much for joining me. This is the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Hop on over to holisticdentistry.au. Check out evolvedental.com.au. If you'd like to book an appointment, we can be reached on 0737201811. If you are listening, watching on YouTube, please subscribe to the channel. Give us some likes. If you're on Apple Podcasts, leave us a review. Do share the podcast with your friends and family. Let's get the message out there. Thank you once again for being a really big reason why I do what I do. Thank you for joining me. And until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.